I've been invited by Symbiosis to actually talk about the emerging trends in clinical trials. I spoke today about the importance of decentralized clinical trials and how it's changing the landscape of clinical trials as well as clinical research and development across the world. Decentralized clinical trials is a terminology which actually means how clinical trials are integrated into the fabric of the patient's life. The traditional clinical trials, which are called as the brick and mortar studies or sites, used to have patients come to the sites and then the data from the sites actually then go back to the sponsors. In a hybrid format, there are some visits that the patient does at home, and there are a larger chunk of visits which happen at the clinical trial site. The most advanced form of a decentralized clinical trials would be the virtual trials, or what is also called as the siteless trials, which means that the patient does not even have to come to the clinical trial site. Now, this would be a great advancement for obvious reasons. It will improve the efficiency of global clinical trials. It will enhance the participation of clinical trials. And most importantly, it will also bring in diversity, because patients who might be in far-flung regions of India or other parts of the world can now aspire and participate in a clinical trial. There are several technologies in clinical trials which are part of decentralization, like direct-to-patient participant shipment of clinical trial supplies, home healthcare nursing, wearables or digital health. There are also EHRs and EICFs and e-consents, etc. All these enable patient participation to be made smoother, more efficient, as well as ensuring patient convenience as well as safety. Thank you once again for the opportunity to be part of this whole symposium and workshop. And I would like to say that this will be much better for many of the students as well as those who are participating. Thank you very much.